Okay, today we're going to talk about ethics in paramedicine. What I want to go over is what we're expecting of you, not only in the class, but once we get you out into the field. And when we talk about ethics, there's a couple different things that we're doing about it. Ethical issues talk about what's more of doing the correct thing. It's also getting into a little bit of those legal issues of what's the right thing to do, and making those decisions in the field. Different from morals. Morals is basically what we decide up as a social group or a religious group, or it's kind of our personal standards. The problem with morals is morals are different from societies, from countries, every different type of thing there. But we use a combination of morals and ethics to make our decisions and things that we do. Now, when we're talking about laws, laws are a much narrow effect. Those are a set rule, very defined, where ethics is basically a wider or broader area of looking at what to do the right thing. When we're talking about the laws, we're talking about impartiality, or we hope to be impartial about this, and coming up with a specific set of rules where ethics can come from several different things and experiences, religious aspects. So when we look at here, you can see the different scopes. We want to be where we meet in here. When we talk about medical issues and treatment, there's a lot of things we can do in the medical area that may not be ethical and may not be legal. So we want to hit those parts of making the best ethical, legal, and medical decisions and working within those realms. So when we're making those decisions, there's three different schools of thoughts. So it's one that we each decide on how we behave, and we hope that everything comes out okay. That obviously doesn't work out necessarily so well. The next principle is basically that you should do everything right. Again, not everyone follows that. And then the last concept is that you do the decision and we judge later whether it was right or wrong. Obviously, those are not necessarily all the best ways, but that's kind of the three ways that we decide from that. There's certain principles and qualities that we expect, and these are what we expect of you not only in class, but outside of class. And you can see these are great principles up here, and we're expecting of these, and we're going to be grading you guys on these as well, as we've kind of talked about in the interviews. All these different things of how you respond to not only your patients, but to your coworkers, everyone else that you're going to be interacting with, especially when you're representing us or your departments later after you graduate. So big factors that we're all going to be dealing with. Ethics have a huge aspect, and us as paramedics, we are going to be so much involved in those patients' lives that we have to be a very ethical person dealing with everything we are. We're being brought into their homes. We're being able to allowed to take care of these patients and their families. So our biggest thing is what is in the best interest of our patient. That's what we talk about, our patient advocacy. And we got to be looking at what's the best thing. We talk about the golden rule, but there's also what's called the platinum rule. The golden rule is you do what you think is best, or how you'd like to be treated. But the platinum rule is how would they like to be treated? What is the family's desires and descriptions of what they want done for that patient? So those are the big things that we're looking at, and everything that falls within the state and local laws and our protocols. So big thing is we are have an obligation to that patient of first doing no harm. That's basically in medicine, when I took that, our code is at first do no harm. So that's what we're looking for you to do. But you have to be able to treat that patient. You have to determine what happens to them. Now that patient has the right to make decisions for their own body. They can withhold treatment. They can say, no, I don't want to be treated on this, as long as they fit within the certain qualities of being a competent adult patient. And we have to follow those rules and restrictions out there. But we have to be able to also work on those and decide when can we work on that patient and when we can't. How do we decide about that? And when we come up with that ethical problem, usually the different things we do is we look at what has been similar. What are decisions have made from other problems that have been simulated from this? And am I following that rule? Can I make a decision on this, and this is going to be the right person for the right thing for the person? So there's different kind of tests that they talk about of coming in. An impartiality test is, if I were to do that on you, would you accept it? The universal attested, would everyone be able to? And then can you defend or justify your actions if you were to do something on a patient? So different type of things that you have to be able to ask yourself is, would you do this on your family members? Would you do this on yourself? Other things like that. And those would be things that can help you with an approach to determine is this procedure or the thing I'm going to do ethical? We're going to talk about DNRs in different situations. DNRs can be very confusing of exactly what to do, and there's a bunch of orders on there as well. But it's finding out, and basically the first thing is determining what is a valid DNR, making sure that it is, and two, reading it and everything on there. Again, first do no harm. So we want to basically ensure that we're following that, because that is a legal document that we need to follow. But it's also reading on there. There's a lot more to a DNR than just a DNR. There's comfort measures. There's a lot of different factors in there as well that you need to know. And so we're going to put you through this. The other aspect is patients making decisions for themselves of just going, yeah, I just want some comfort, but I do not want to be transferred to the hospital. Then we got the family members who say, no, I want you to fully treat this, my loved one. And you have a DNR, and so it's kind of going, what do I do? So we're going to put you in those some situations and talk about what we think you should be in. Because, again, a lot of the times, if we're not sure it's a valid DNR, we have to start resuscitative efforts. That may not be in the best interest of the patient based on there, or if we can't find it, but we have to do it. Then we're going to talk about the confidentiality issues and the HIPAA laws, everything that we need to follow on that. Very important. Again, you're putting in the trust of the patient, and Spokane is a 1 to 2 degree separation. So little bits of information that you can pop out is going to lead people to know exactly who was involved. And we actually had this happen with a student one time. So we take this very seriously, of confidentiality and treating each patient out there. The other aspect we're going to get into is the consents. So when can you treat someone? We're going to talk about the implied consent. We're going to talk about minors. We're going to talk about when people are impaired either by alcohol, medications, drugs, other issues on there. So a lot of different things. And then how we're going to be able to deal with treating those patients based on what resources we have. So how we triage them, what areas we have when we don't have a lot of resources, and where can we go to get that. There is obviously an obligation we have to provide care when we're duty, but when we're off duty, what do we have that protects us? Well, we're going to talk about the Good Samaritan law and how that affects you treating when you're on duty, when you're off duty, and then dealing with off-duty personnel like physicians that stop by. Another important aspect too we're going to be teaching with you in the class is to become an educator. That will be your job as a paramedic, is not only to teach to the community, to your EMTs within your department, but you're also going to be teaching to physicians, to nurses, to other people, tame what we do as a paramedic. And I'm educating people all the time of what people do as a paramedic. And there's a lot of people in the medical profession who still don't know exactly the difference between a paramedic and an EMT, a volunteer and a paid professional. So a lot of different things. Then we'll talk about physician orders and what you can do. We're going to talk about medical control. We're going to talk your SOPs, and we're going to talk about, can you push those bounds? When can you go outside those medical orders, and when shouldn't you? And is it an acceptable or moral thing to do or not? But there are times when you are needing to go above and beyond, and you can't get a hold of that medical control, and it's making those decisions. So I want to talk to you about what those are and show you what Dr. Edmister thinks and what I think and what Gary thinks. And so we're going to put you in some of those scenarios. Other thing is there's a lot of things that they do in Idaho that we don't do in Washington State. And so we're going to talk about research. We're going to talk about pushing those bounds. What medications and else can we do on something that we're not currently doing? And when is it going to be a working effort that we can do here? Realistically today, what I want you to do, again, is having that good ethical decision-making processes every time you're looking out for that patient. Again, we talk about patient advocacy, and you are the person that's going to make those decisions. And dealing with, when is it the right thing to touch that patient, to treat that patient? When is it okay not to treat that patient? And talking about the moral dilemmas that come up and arise in our decision-making. Every time you made an action, you have to be thinking about, is it legal? Is it helpful? Am I doing any harm with this? And is this in the best wishes and interest of the patient and that patient's family? You follow those guidelines,